Thank you, Madam Chair. Good afternoon. As stated, I am Dr. Gil Wright. I am the Director of Metro Public Health Department, and it's our mission to protect, improve, sustain the health and well-being of all people in Nashville and Davidson County. And with our team of just over 600 dedicated workers, we strive to do that each day. First, I want to thank the committee for our chance to discuss our budget requests today. Want to do a little housekeeping as far as just history of some of the things that council and administration has allowed us over the last year or years to do. And the most recent capital spending plan included an appropriation for a future replacement of our Woodbine Public Health Clinic. That clinic is our busiest clinic, which currently is housed in a 100-year-old former school building. The plan also included funding to begin design on a new Metro Animal Care and Control facility. There remains a long way to go on each of these projects, and we look forward to working with council and administration to complete these projects to ultimately help more Nashvillians. We're also thankful for the support we've received to transition our clinical operations from paper to electronic health record, a process we're currently working through. We understand the need to be patient as we continue to move forward in serving our community, and we remain excited about the future of our work. At the Metro Public Health Department, we love to talk about the things that we've done and accomplished, but even more important is those things that have not happened due to our efforts. Over the past year, a potential meningococcal outbreak was mitigated by an immediate response utilizing contract tracing and quick dispensing of medication to contacts. Metro Animal Care and Control Safety Net program is a lifeline to more people. It allows them to keep their pets in their homes, providing resources to head off an avoidable animal surrender. Routine restaurant inspections conducted by our team help prevent foodborne illnesses, and then services provided by our WIC team ensure fewer families suffer food insecurity, at least during the child's early years, with 22,000 participants across the program. More people are getting a healthy start for their early life. One of the most effective ways to avoid preventable sickness is through childhood immunizations. And our team works to ensure childhood immunizations are accessible to our whole community. Nashville remains at or above the statewide average for nearly all childhood immunizations, according to last year's 24-month-old immunization survey. All these are core parts of the work that the health department does, all of which are often measured by things that do not happen. We appreciate all that council approved for us in last year's budget and have some promising results to share. Over the particularly active flu season last year, our team administered over 4,300 flu shots with a focus on ensuring access to those who have historically seen poor access to health care. By adding a full-time community-based vaccine clinic coordinator last year, our team was able to bring vaccines to more people, eliminating potential barriers to health. At Metro Animal Care and Control, the addition of an animal behaviorist has been key in finding the right home for many adoptable animals that otherwise would not have been adopted. With more than 1,700 adoptions celebrated over the last year, we appreciate the work that's been done there. Metro's previous budget moved all of our interpreters from grant funding to local funding. This has freed them up to deliver more in-person interpretation services, often with a better experience than over-the-phone interpretation services. Our Nashville Strong Babies program, created initially to bring specialized services to specific zip codes where infant mortality was highest, is now expanding county-wide as we've seen the need for these services broaden beyond the initial area. As we track data of where services are most needed, we adapt to the need to meet that. With the funding provided in Mayor O'Connell's budget proposal, we'll maintain our diligence to avoid potential outbreaks. Our areas of focus remain the same as they've always been, working upstream to prevent or reduce future health problems and eliminating barriers to ensure Nashvillians can live full, healthy lives. We'll continue our expansion of behavioral health and mental health services, ensuring we identify and fill gaps that exist in the local community of behavioral health and wellness needs. We expect another year of strong back to class numbers, thanks to a large part by our talented team of school health nurses across Metro schools. Our sexual health center continues to prescribe and supply PrEP medication to those looking to prevent an HIV/AIDS infection while offering affordable testing and treatment for sexually transmitted infections. Our collaboration with Mental Health Co-op, Metro Nashville Police Department and Nashville Fire Department will continue through the Partners in Care and the REACH programs. And our air pollution team will continue to work closely with the community to ensure our air remains healthy and safe to breathe. With reminders of forecast air alert days circulated in ways that more Nashvillians can access. We take our mission seriously. We'll continue to keep the public's health and wellness front of mind in all decisions we make. With the health department have fostered a great respect for much of the work done here at Metro Council, and we look forward to continuing the collaboration. We're looking forward to expanding our operations and offerings more services for the community in coming years.
Thank you, Dr. Wright. I'm going to kick it over to our Public Health and Safety Chair, Chair Evans, to see if she has any initial questions.
Thank you, Chair. I've got, of course, several, as I'm known to do. So you can confirm REACH is officially funded for this upcoming budget cycle?
Yes, ma'am.
Okay, awesome. And then on Metro Animal Care and Control, so I know this has like been an ongoing struggle, and I know it's a known struggle in the community too. And so I guess, it's not something that's easily done this budget cycle at all because of us needing to remain flat. But what, I guess, is the vision on making some of those positions more appealing? I know we're competing a lot, with private vet facilities and that kind of thing, but what are your thoughts on that?
Well, last year's salary increase, minimum salary increase helped, and I suspect that further increasing that will help us to fill those positions. Actually, currently, we only have about, I think, 6 positions that are unfilled at the moment, and 2 of those are due to recent promotions, so they've opened lower positions. So those are brand new. The others have been here, they're a little longer, but none of them are over a significant long period of time that they've been open. So we are seeing much better. The other thing that's been very helpful, we have Ashley, who is our director out there, has been great. She's stabilized the loss that we were having and really been very supportive of her personnel, and we're very grateful for that. I think those combination of raising the salary and also just having a good manager that showing care has helped stabilize that.
Yeah, I think Ashley, I really appreciate her support, and she's very responsive. So I think she's doing a great job. I think we just need to figure out more ways to support her and what she's doing. And I don't, I've said this before, but I don't want to be animal control. And sometimes I feel like I am in my area, and other district members may feel the same way. On the kind of dovetailing into that related to MAC on spaying and neutering, we've had a lot of conversation. Like we've got a working group, a pet working group, with the council that Chair Wiener and Chair Stiles are leading, and Chair Bradford as well, working on that. But on the spaying and neutering component, I know, it's every spay and neuter clinic is really backed up, and it's really difficult to get into low-cost spaying and neutering in Davidson County. And so a lot of people are having to go like to Sumner County or Wilson or, wherever. And so, I guess thinking ahead, to next budget as well, not this one, but look, thinking of are there opportunities for us to have more public-private partnerships with local vets? I'm thinking of ways to, kind of fill in the gap on some of that challenge.
Well, actually, last year, we were added a second vet and some vet techs. Got close to hiring, but weren't able to hire. We actually just last month, through our board, changed the salary range for our vet because it is very hard to get shelter vets and vets in general. But hopefully that will increase our ability, and then we'll be able to do more in-house to some degree. So that will be helpful to help address that. But you're right, it is tough across the county and across a lot of communities right now.
So it sounds like there's the potential then, that of maybe future looking at like spay and neuter clinics being done by animal control.
And we're looking at, funding through grants and stuff to do that external to us if we can't do them internally.
That's great news. And then on the community safety programming, so I know, I feel like I've gotten questions, Chair Gamble's gotten questions, like there's been a lot of questions floating around about community safety. And I know, we've got like the folks from the original community safety program on the nonprofit end who receive funding and are going through that process of fulfilling their grant contracts and getting paid and those kinds of things for their work in the community. And then we also have like the Department of Justice side with that grant. And so I guess, can you speak to kind of the overarching, I feel like it's like we need a Venn diagram of community safety programming and like what money is left and like ARP funds and how it all dovetails, together.
I will as best I can, because like you, it changes on a daily basis. We are continuing to apply for grants, and so we're seeing more grants. We did, as we moved the community safety from the mayor's office to the health department, we had to chase down a lot of the contracts. We had to chase down the amounts that had been paid. All of those have been identified, and we've been working closely with the recipients. And I'd say 90% are doing really well. There are a few that just don't understand what they were being asked to provide, and we're working with them. I'm actually going to meet with one group that's kind of gone through a number of other levels to try and help where we can. But you're right, we are in the process of hiring. We will have about 30 people hired in the next month or two, backfilling those positions that we did lose from that transition, as well as other in our behavioral health. The other thing that we're currently looking at is our overall organizational chart. And one of the things that we're definitely looking at is our major divisions are called bureaus. So we're looking at an elevation of that, what is currently a division under a bureau, moving that into a larger setting or a larger organization, because we are going to continue to grow it. And it has responsibility for that community safety. It has responsibility for counseling. It has responsibility for opioids. So lots of things fall under it. And I've, as part of the organization, look, I've added a number of things I'd like to see us be able to add. Maybe not this year, maybe not next year, but in the coming future that would fall under that.
Okay, thank you. And then so the community safety, I guess the continuation, I guess, from the Cooper administration to the O'Connell administration. So the grant funding for those organizations that we had approved last term, are they going to be able to apply for grants going forward as part of this budget?
I believe that is in the budget. We're still having some discussions with the mayor on that, but as of this morning, understood that was going to be included.
Okay.
There would be some money available.
And then kind of on the, going back to one of the funding aspects that we had last term on the community safety side related to the Cure Violence program, we had the one grant where we didn't end up coming to an agreement related to a couple of the organizations that were involved. And so that money, that I believe it was $1 million, did it make it to the health department, or is it sitting someplace else?
It's sitting with that group that originally started that community oversight group, or I can't remember the exact name of what it was that made those recommendations. And we're still willing to move forward with that if it gets brought back from council. So, and prepared to do that. But in the meantime, we'll continue to do the other things that, we do have up and running.
Okay. And then, so the Department of Justice grant, because that was for $2 million. And so, that I remember, and that was something we approved at the beginning of this term. And so the purpose, I guess, to your point and
Yes.
comments about hiring people, so that's specifically for like violence interruption and
Yes.
those kinds of things.
And it really, I think when it was originally written by the staff in the mayor's office, it was really written as an adjunct to the cure violence pieces. We don't have those in place, but that doesn't mean we can't go out into the community and work towards intervention.
Okay, thank you. And then on the opioid settlement, I know we should be getting close to like probably having something that comes to council, right?
We just had a meeting with one of the potential recipients and the buyer's agent to finalize some pieces. And so that was just this week, or late last week, excuse me. So we should have something coming very soon.
Okay, I think that's all that, oh, and I guess last question for me, and maybe I'll have more later, is the 1.4% savings, how did you all implement that in your budget?
Right. We're looking at that as a recommendation that we need to do that, and we expect that will occur through just simply having to leave some positions as they become open a little longer to be able to absorb that.
Thank you, Chair Evans. I see Councilwoman Quinn Evans Siegel, followed by Councilwoman Gamble, and then Councilwoman Allen in that order. Councilwoman Quinn Evans Siegel, you're recognized.
Thank you, Chair. Just wanted to talk about number 5 on the questionnaire for just a second. It says the department made the request to improve upon current services provided as well as to meet increased demand for services, most specifically family planning services. Just kind of curious what family planning services may or may not be provided. What are people seeking?
Right.
Yeah.
Family planning is exactly what it sounds like. It's providing services from birth control to if they're planning on a family, making sure that they get started on folate, get referred to a physician or provider that can take them on at that point, and all the things around that. Also would involve being sure that we look for a little different area, a little different grant, but still tied with it is sexually transmitted diseases, obviously, and then all of the cancer screening that would be associated with it. So cervical cancer screening, breast cancer screening, again, a little different funding to do that, different grant, but still part of that overall wrap that we kind of put under our family planning and community health. Yeah. The other thing I would mention is one of the 3 things we asked for was some increased positions, only because currently at our Woodbine Clinic, we talked about that being our busiest clinic. Right now, we're currently accepting appointments for August. So we would like to be able to expand that so that we can provide more services. The other concern we have is we're not sure what the state's going to continue. That's a pass-through grant, so we're not sure what, but so far we've been getting funds.
So I know there's a delay. Are there any other repercussion services we won't be able to provide, things we won't be able to do?
No, this is the funding that we're at has been providing all of the services. It's just, we know that clinic, especially as we start to look at a new home for that clinic, it has a real potential to continue to grow. And so we would like to be able to support the population that would use it. So we just know that waiting time will get longer and longer down the road. But we understand that we're not moving, in the next year. So we've got a little bit of time, but we will continue to look for outside funding wherever we can for all of those separate things. Right now, we're about 60% grant funded.
Thank you. That's helpful. I think these are incredibly important services, particularly in Nashville right now. So
Absolutely.
want to make sure that we're supporting health, sexual health, family planning health as much as.
Thank you.
Thank you, Councilwoman Quinn Evans Siegel. Now we have Councilwoman Gamble. You're recognized.
Thank you, Chair. Thank you all for being here today and taking questions. My questions are kind of follow-up to Chair Evans' questions about the Community Safety Partnership Fund. Just to clarify, you mentioned that you're hiring 30 new staff members. Is that a part of the grant that you received?
It's a combination of a number of grants, all kind of in our behavioral health area.
Okay.
So in conjunction with the John Jay, which is the DOJ grant, in conjunction with opioids, in conjunction with other things that other grants that we've got currently.
Okay.
So.
Thank you for that clarification. And you mentioned that the funding that was allocated towards the Cure Violence and the Community Safety Partnership Fund, I believe there may be about $2 million left in the Community Safety Partnership Fund and the $1 million that we didn't spend for the Cure Violence. You said that it's still with the committee. Does that mean it's not in your budget?
It's not in our budget.
Okay.
It hasn't been, there's no allocation for it to be spent. So therefore it has come to our department.
Okay, so it's still within the mayor's office? I guess.
Someplace, yes.
Okay. Thank you. Thank you.
Thank you, Council Lady Gamble. And I'm going to go in the order that I think I saw. And if I missed you, just raise your hand because the fellas in the back over there, they all shot their hands up at the same time. So I have Councilmember Allen, Councilmember Huffman, Councilmember Nash, Councilmember Cash, Councilmember Spain, and then Councilmember Prepty. Did I miss anybody? Oh, okay. You look like your hand was up, Councilmember Cash. All right, I'll cross off the list. All right, Council Lady Allen, you're recognized.
Thank you. Just to finish up on the community safety, you mentioned possibly creating another bureau. Would that position for that bureau head be one of the 30 that you're looking to hire, or?
It actually, we probably have the funding to be able to elevate that position from the current level it is up. It would be backfilling.
Gotcha. Just seems like it'd be good to know who's in charge and,
Yeah.
and have somebody have ownership of that. So
Yes.
I think we all think that's really important. Would be thrilled to get it going. And then to go back to some of the items that were on your priority list that are not currently showing up. There was, as we mentioned, a nurse practitioner who was looking at long-acting reversible contraceptives.
Right.
And also immunization, and then some ESSER funds. Are those things that possibly will be funded by grants because y'all are so good at getting those, or are we?
There's always that possibility. I don't want to say that I don't know right now of any. The ESSER funds are really the school nurses.
Right.
And those are just gone. But my understanding is that that's in the school.
In the school budget?
In the
Because we
school
heard
budget.
today that all the nurses were there, and I
Yeah.
couldn't reconcile
So they're
that with
not
what
in
I
our
heard.
budget, they're in the school budget. We
Great.
have an MOU, and I think that there were some leftover funds previously that could be continued to be used
Gotcha.
to help fill that out. This next year is kind of a bridge into budget 26.
Okay, so it's possible these things could still take place, but
Right,
they all
absolutely.
seem really important.
Yeah.
Okay, thank you.
Sure.
Thank you, Council Lady Allen. Next, we have Councilmember Huffman, followed by Councilmember Nash.
Thank you, Chair. Just a quick question regarding your Healthcare for the Homeless program. Could you describe what that coordination looks like with OHS? Or if this is a new program, just tell us a little bit about it.
In actuality, I think that is a grant that we've given for a fairly long time to Neighborhood Health to provide care for that group. When we left doing, the department left and stopped doing primary care to that population directly, we started giving a grant to a community entity, and that's been Neighborhood Health, to provide those services. So it's not new, but it hasn't changed.
I knew, okay, all right. And you mentioned your behavioral health services program. That's new, correct?
That is, we have always had a behavioral health, but it has been staffed in the past by people that were not clinicians. We have now hired a clinician to lead that, and so we are moving more into clinical services, such as counseling and such. We know that for almost all communities is a big need, especially after COVID. And so we hope to provide a counselor in each of our clinics hopefully within the next year as we build that program. Also, to provide some support for the opioid pilot program that we're putting out, so that we have some additional people that can provide additional counseling as needed.
Great. And the providers that are performing that, are they eligible for any like SAMHSA grants since they're documenting, or is that not applicable because of just how it's being done through the local entity?
I believe because it's a local entity, I don't believe that we're available. There would be money for neighborhood health, possibly through SAMHSA.
Councilmember Nash, you're recognized.
Thank you, Madam Chairman. Last term, this council felt we were at an appropriate place where we could abolish emissions testing for our air. And I was wondering if there'd been any follow-up. How's our air doing?
There is follow-up. I have at least 2 engineers that kind of routinely follow that. John Finke, who was in charge of that program, has now moved into the Bureau Director for Environmental Health. He continues to follow that closely, and actually is first of next week will be at an air conference for 3 days. So they do continue to follow that. They continue to look at opportunities to do things to help improve our air and keep it good and clean. And we'll keep bringing ideas back as we see fit.
Thank you. Again, so the emissions control, doing away with that program hasn't had
We
any
haven't seen a
impact.
significant change.
Thank you.
Yeah, it has to do with the newer vehicles are so much better. So.
Thank you, Councilmember Nash. I now have Councilmember Spain, who will be followed by Councilmember Prepty, and then going back to Councilmember Allen.
I'll pass.
You sure? Okay. Well, we'll keep an eye out in case you decide you have a question, Councilmember Spain. Councilmember Prepty, you're recognized.
Thank you, Madam Chair. My question has to do with the school health program. I'm curious, under this budget and our current funding structure, how many school nurses are we able to provide to our over 150 MNPS schools?
So we aim and have pushed for a long time to have a nurse in every school, and in some schools, more than one. A high school with 2,000 students in it needs more than one nurse. Those schools that have special needs children need more than one nurse. So we say that a nurse in every school, but dependent upon the population, obviously. Under the ESSER funds that I said were expiring, the schools have provided, there was money for those through that grant, and that is going away, but there is still funding for those for the next year. We currently are pretty close to having a nurse in every school. We do have some open positions, and that changes from time to time. During this time of year, it's a little higher because we try not to hire any nurses after the 1st of February till it gets to be closer to the school year, because we pay them year-round, but they're only 71%. So they could get into the situation where if they accepted a position, started working in February, By the time they leave in May, if they don't start the school year again, they'd actually owe us money back. So it's not fair to them. And we're able to support that with our supervisors for that period of time. So we have that. We have an MOU with the schools. If they hire those, then we supervise. Yeah, and then, of course, we use temporary, to help fill some of those positions.
And so that the following up with to that is, so within the specific funding structure, does the health department exclusively fund those, or is there sort of cost sharing between the health department and MNPS?
Right now, most of those will be within the schools, and we're open to moving those to public health or leaving them with the schools. We've had a good relationship with schools and how they're used, so we're fine with that. We just want nurses there.
Thank you.
Thank you, Councilmember Prepty. Councilmember Allen, you're recognized.
Thank you, Madam Chair, for letting me have a second go around. I want to follow up on the question about the air pollution. Mr. Finke's team has done a great job of publishing a very detailed and helpful annual report, and we don't have one since like 2016. So would it be possible to get those back on the website? Because I would love to be able to point to that and say, here's proof that our air quality is still good.
Yeah, I will talk with him. I do think that, I'm not sure how much we'll get from, but we'll try and get it.
I know COVID knocked them for a
Yeah.
loop, and it takes a while to put them together, and I'd be willing to sit down with them again and say, here's what you can leave out, but I have found them to be really helpful and love to see something,
Sure.
so, thank you.
Absolutely.
Thank you, colleagues. Do we have any other questions? Okay, I have a few, and then I'll go to Councilmember Evans. And I just want to clarify, I believe, Councilmember Evans, the first question that was asked was about Partners in Care and REACH being funded, and I wanted to clarify, are both of those programs fully funded in the budget?
Yeah.
They have been, we haven't seen a budget for FY '25 confirmed by the council yet, but as long as the funding is stable from FY '24 to FY '25, the answer is yes.
Okay, and that wasn't in the microphone, so I will say
Yeah.
it for the viewing
Yeah.
audience. The answer is
The
yes,
answer is yes.
assuming the council approves this
Yeah.
budget. So thank you for that. And then my next question was, back in December 2023, and then again, I believe in around February of 2024, there were reports of, I believe they were nationwide reports of the numbers of syphilis cases going up. And then here in Nashville, the number of cases were going up as well. I believe that may have been possibly linked to a shortage of penicillin, but I'm not completely sure about that. Can you kind of speak to that and what y'all are doing to address that and where we are now?
Right. It is linked to a shortage of bicillin, which is an injectable penicillin. And actually what happened was a tornado hit the storage facility of the company that was making it. Didn't hurt the line, meaning that they can still produce it, but all that was in storage was destroyed. So that did cause some. We're able to use some other medications, and so we are getting up to date on the penicillin shortages catching up, but it's a little slow. But before that even, we were seeing numbers of all of the sexually transmitted diseases rise. And I think that some of that has to do with a number of apps that are out on your phone where you can hook up and we cannot do contact tracing because what we would typically ask is, who were your sexual contacts? I don't know, it was Joe and I met him on Tinder. So that makes it a little tougher. But we're trying diligently to continue, and I think that was nationally. I don't think it's just us. But that's one of the issues and unexpected issues, the consequences of technology. So with that in mind, though, we are looking to continue to do high level. We've actually are doing some cross-training between our disease investigators for foodborne illnesses or reportable and community reportable diseases and our sexually transmitted, and actually looking at how we also train them so that when and if hopefully never we get another epidemic or pandemic, we can immediately transfer those over to contact tracers, which is essentially what they're doing just for a different disease and illness. But we continue to do outreach to the jails. We continue to outreach throughout the community to try and get these cases under control.
Thank you, Dr. Wright. So in addition to avoiding Joe from Tinder, is there, for anyone who may be watching, what type of information do people need to collect in the event that they need to contact y'all for contact tracing? I think that may
Right.
be good for the community
Well,
to know.
you know, it's always obviously easier if you do have a sexually transmitted disease to know who you've had sex with, and that's sometimes uncomfortable. You may have met them, you know, may not know exactly where they live, whatever. And then the other thing is just condoms and other barrier methods to prevent that. You know, we're seeing, you know, we're trying to make sure that we have our prep so that we can try and prevent expansion of HIV and AIDS. And so we continue to offer all of that testing and such. So.
Thank you. And to bring it full circle with the purpose of those questions, you all have the funding that is needed to educate the public on these things and to provide necessary resources for the public. Is that correct?
That is correct.
Okay. All right. Thank you. And then Council Lady Evans, you're recognized.
Thank you, Chair. I want to go back to, I guess, two things. On the behavioral health side with the 30 positions and the response to Chair Gamble's question about the, I guess, makeup of those positions and that being combined with other grants. Would you, as a follow-up, and I guess maybe this is a question for Chair Porterfield, are we sending questions in? Like, I'm thinking I'd like to understand the makeup of like what positions are being hired and what grants kind of feed those positions. Would that be a better question to email in?
Yes, you can send that to Director Darby. Actually, if you could send it to Maria and CC Director Darby, and then they will compile those questions and get answers and put them on the budget SharePoint.
Okay, cool. Because I imagine that's probably not something
And-
you know off the top of your head.
No, I don't. And if any committee member or any council member wants to come meet with us at any time on any subject, we'll be glad to, you know, give them an in-depth look.
Okay. And then I know we talked about like the ongoing grant opportunities. You know, last term we had, one of the outcomes of the Cooper administration was the creation of the village, you know, which is where a lot of those organizations live now, in those relationships. And so that's, I guess, I don't want to be in a position, I guess, where we're reinventing the wheel on some of these opportunities. And so do you envision the village being kind of the administrator? Is that still part of the conversation that you're
It's
having?
still part of the conversation. Actually, Dr. Black, my deputy, and I just had a drawing on the board today to try and figure out, because we have money that's going to the village and we have some people that are part of the village that get money under contract. We're trying to figure out how to make that work in the best way.
Right.
So,
Okay.
yeah, that is on the top of our radar.
Okay. And then on the decisioning side, and I know this is also maybe a process question you don't have an answer to, the decisioning side, you know, under Mayor Cooper, we had kind of the committee of members who participated in that conversation and scored their grants and all that stuff. And then the funding allocations came our direction. And so is that also potentially something you all are discussing kind of related to these allocations?
If we're given money that's to specifically fund community organizations, that was also a discussion we've had. In the past, we've had funding come to us for community grant making, and we can easily set that process back up. So, yes.
Okay. And Health Equity Bureau, is that, I thought that was gone. So does it exist still in some formulation?
We have changed that bureau's name to People and Culture. We do have within it specifically a health equity division. And there's whole lots of different reasons behind that we can discuss offline.
Okay. Thank you very much. That's all I had.
Thank you, Councilmember Evans. Colleagues, do we have any other questions? Okay, seeing none, thank you so very much, Director Wright. We appreciate your time and all the work that you all do for the community, so thank you.